Welcome, everybody. This is Dr. Heath McAllister, and today we're going to talk about exosomes and the cardiovascular system. So, the cardiovascular system that refers to all our blood vessels, our heart, major arteries, and so forth, all the things that really are important to keep functioning properly throughout our lives, considering heart disease is a major killer of Americans and worldwide. So, that's what we're going to talk about today. So, first of all, I want to introduce what exosomes are. If you're new to that term, it's not yet a household name, but exosomes are what are considered extracellular vesicles. So, basically, they're a little budded off piece of cell membrane that has instructions inside of them, usually in the form of what we call RNA. There could be proteins and different lipids and so forth. But essentially, they create this little payload budded off from a cell, and those little vesicles can travel to neighboring cells, merge with the cell membrane, release that payload inside the cell, and then those instructions, like the RNA, go into the nucleus and stimulate protein changes and so forth. So, this is considered to be the major cell communication reason behind why stem cells are effective when we do stem cell transplants, is that they produce these extracellular vesicles that then distribute those instructions to all of our neighboring cells. So those are what exosomes are. They don't roll off the tongue like stem cell does, but essentially think about them as a stem cell extract or as the messenger of stem cells. So it's important to note that there's different kinds of exosomes that are created, and basically the exosome will mirror the parent cell. So if you have a stem cell and you make an exosome from a stem cell, that exosome will have that payload representatory of how a stem cell would function and the vibrance and the liveliness of a stem cell. Versus you can take an older cell and that cell can create exosomes also, but they're also going to be reflecting the state of health and the potential of that other cell. So just keep that in mind that not all exosomes are considered equal. In fact, there's a lot of very wide variety of quality and quantity of exosomes that are on the market. So you just want to be careful and know what you're getting. Now, how might extracellular vesicles or exosomes support heart and blood vessel function? So, there's several different proposed mechanisms that have been researched and validated. So, it does seem like the exosomes can improve the blood vessel lining. So, that's a layer. If you imagine your blood vessels as a hose, that's the inner layer of the hose where the water is flowing. That's called the endothelium. So that endothelium is responsible for a lot of really important things in our body, including regulating our blood pressure and the stickiness of how plaques can build up in that inner lining. So by having enough support for that inner lining, you can both increase nitric oxide levels, which is a dilator of our blood vessels, and you can prevent stickiness from attracting plaques. Exosomes also promote new microvessel growth, so that's called angiogenesis or stimulation of new blood cells. As time goes on, we need to create new pathways for blood to flow. If you work out, you'll see that in bodybuilders where they have really prominent veins. Well, they've got larger diameter veins, but they've also created new collaterals. So if you want blood to flow to an area, you have to have the plumbing that gets it there. And so that process of angiogenesis can be really important. The other thing that extracellular vesicles can do is it can both help stimulate less scar tissue, which is a process we call fibrosis, so that you don't overscar, right? Scarring is a natural process we want to have happen because it comes in after injury. After injury, you want to knit the tissues back together so that that wound won't be perpetually open, but you don't want to overdo the job. If you overdo the job, you can get really thick scars to the point of some people have things called keloids. Well, exosomes help guide tissues not to overreact and overproduce scar tissue. Uh, Exosomes have also been shown to reduce cellular death. So if we think about all of our cells have a regular lifespan and a turnover and so forth, and if you can extend that lifespan, that is literally cellular longevity. So when we use the term longevity, we usually think about our life, you living more years, let's say. From a cellular standpoint, it's your cells living longer, and exosomes seem to encourage cells to live longer. So there have been some rodent studies where if you give exosomes, either injection or IV, you can see, many different important physiologic benefits. So you can see that the blood vessel thickness, of a animal treated with exosomes, it's less thick, meaning you have less plaquing. If you treat animals with exosomes, you will see that they have it's a greater a reduced size of an infarction. So infarction is the term we use for a heart attack, and you're going to get less of that. Again, less of that blood flow getting blocked. So the thickness of the arteries and the ischemia we call it when you don't have enough blood flow to an area, those are all improved when you treat animals with exosomes. Now, what are some other things? I mean, going back to the blood vessel thing, I didn't mention this, but one of the ways your heart functions well, not only is it the pump for all of your blood going through all of your body, but your heart also needs to be fed by that blood supply. So you have these small blood vessels. We have the coronary arteries and the left anterior descending and these various different nails, right circumflex, or these very different arteries that actually siphon off a bit of your blood flow and feed it back to the heart tissue or the myocardiocytes, which are the cells of the heart. And so when you treat animals with exosomes, when you're giving exosome treatments, you will see that you have increased markers of angiogenesis, so more blood vessel growth, more capillary growth, especially in areas of injured heart tissue. And you'll also see the endothelial cells healing, migrating, surviving, forming new blood vessels. So that whole remodeling process that is essential for surviving heart disease, for thriving through heart disease, that is stimulated by exosome treatments. Um, Now, one other thing that exosomes do is they're really helpful for lowering inflammation. So, inflammation isn't necessarily good or bad. It's a natural process that happens in our bodies all the time. Inflammation is a key to how we heal and how we stimulate our immune systems and so forth. But chronic inflammation is where we get into trouble. Chronic inflammation can lead to greater heart stress, can lead to greater cell death, and so forth. So, it's important while we're trying to support the heart that we're also able to balance the inflammation so we don't have overt kind of breakdown of tissues going on too long to just break the system down. Now, when we do have injury, so this is injury anywhere in the body, that's what exosomes can do. Specifically here, we're talking about injury to the heart tissue. So let's say you have well, if you know how you have an injury in your body, let's say you get a cut or you tear something, you tear a muscle, right? That is a physical breaking of tissue, and your body responds by then creating scar tissue to restabilize that. It's kind of like the glue that knits us back together. Um, and if you have too much scarring, then you stiffen the heart and you reduce its ability to pump blood. So if you have, and basically studies have shown that when you have this scarring happen, you have reduced collagen deposition and after a myocardial infarction. If you give exosomes, then you basically help remodel that collagen in really healthy ways. It's the remodeling that's it. It's that you don't want a whole bunch of scar tissue in any one area to really prevent the heart to function. So that's going to affect the different cells that remodel our tissue, like fibroblasts and macrophages that can eat up scar tissue. So less scarring is kind of an endpoint. That's a goal of us to have if we're having a heart attack, have a heart attack where there's less residual damage that you're left with. So I kind of mentioned atherosclerosis. So that is the term that we use for plaquing of the arteries. That's when we build up excessive cholesterol depositions in our arteries, and that eventually decreases the internal lumen of our blood vessels. So the area where the blood actually flows, it has less area to flow through, which means typically your blood pressure goes higher. So in preclinical models, some extracellular vesicles, some stem cell exosomes have been shown to reduce oxidative stress and inflammation in the blood vessel walls. So you're getting less inflammation in the blood vessels themselves. So that's going to essentially allow the blood vessel to be a little bit more open. The other thing that does is that it decreases endothelial dysfunctions, which is that endothelium is that lining in the blood vessel that I talked about initially. The endothelium, if that breaks down, then you can get fats accumulate kind of in the vessel wall. The vessel wall gets inflamed. Well, exosomes, they target all of those things. So I don't know that they will necessarily reverse the plaquing process. I haven't seen that evidence yet, but they're definitely stabilizing that process so that you're not having advancing endothelial dysfunction and atherosclerosis. There is currently also a trial called the Secret HF Phase 1 study, which is for evaluating repeated IV injections of exosomes in people that have non-ischemic cardiomyopathy. So cardiomyopathy, non-ischemic cardiomyopathy is you have reduced blood flow to the heart, and that's producing all of these problems. Non-ischemic cardiomyopathy, there's various different types of cardiomyopathy, but basically these heart dysfunctions. Um, and to see if exosomes can be used to support those issues, to decrease the inflammation, to improve the endothelial dysfunction, and to have significant impacts on quality of life and mortality. So exosomes represent a huge potential for supporting heart tissue, for repairing heart tissue, decreasing that scar thickness, decreasing the myocardial infarction effects, improving blood vessel flow, improving growth of new blood vessels, collaterals to grow around damaged areas to still provide that essential nutrients to the cells of your body. So exosomes represent this amazing force of healing and health for the cardiovascular system that isn't really demonstrated by any conventional drug that exists. There's no drug that exists out there that helps remodel the heart tissue, right? So in terms of actually healing your body from the inside out, exosomes are king, cardiovascular system included. We've talked about in other episodes how your liver, your kidneys, your brain, all the tissues of your body can potentially benefit from delivering this payload of instructions to all of your cells to rejuvenate and heal. And the cardiovascular system is one of those shining examples of how that is successful. So thanks for listening in. If you are interested in this talk, the topic in general, exosomes, you want to learn more, you can hit the subscribe below. You can hear the all of my other full talks. You can also sign up to do an exosome discovery session wherein you get to have me for free of charge, a half hour evaluate to see if you could be a good candidate for receiving an exosome treatment. So take advantage of that. It's there, it's free. Let's see what exosomes can do for you. Thanks for tuning in, and we will talk to you next time.